This is Eyewitness News Health Beat.
And on the Health Beat tonight, we're talking about coordinated cancer care. Tonight, our Health Beat anchor Ann Marie Tiernon shows us how a brand new community health network partnership with MD Anderson is impacting a lot of patients. Some more good news tonight on the Health Beat.
Well, certainly, and MD Anderson, very well known. You know, U.S. News and World Report ranked MD Anderson Cancer Care #1 9 of the past 11 years, 2012 one of them. And tonight we went there to see how the cancer expertise and the partnership that's now 6 months old is playing out here.
Your blood pressure?
I don't feel like I've got cancer, and I don't feel bad.
Wanda Murphy of Fairland is 72. She is a survivor of thyroid and breast cancer. It's the more rare vulvar cancer that's in its third recurrence that makes her treatment especially complicated.
Every time I get something else, I think, oh my goodness, I can't, this can't be real.
This is a lymph node. This is where a tumor recurred.
Her oncologist shows us her latest 4-millimeter tumor.
I think your body holds cancer cells, but they're sometimes never activated. And for some reason, something's activating my cancer cells.
It's in an area that had already been treated with radiation.
She's had a pattern of recurrence, which made it more difficult to decide what would be the best therapy for her.
But because Community Health Network is now one of 9 hospitals across the country affiliated with MD Anderson Cancer Center in Texas, Dr. Sumeet Bhatia can make sure that the best in the nation have collaborated on Wanda's care.
It enables you to reach towards experts in Houston who by volume see far more patients than any one of us does, so we are able to tap into their experience. Take a deep breath.
Bhatia says that can be a phone call, a video conference case review, or even fast-tracking a patient and sending them to Houston. Bhatia oversaw all 3 for Wanda and now is administering the chemotherapy guidelines established in Texas here closer to home.
You know, honestly, I think this is going well. I mean, you're on your 9th dose. Once you get to the 12th dose, we need to evaluate how much further we'll do, and we could probably discuss you again at Tumor Board with MD Anderson and see what they think about it.
Wanda also aims to boost her wound healing by spending time in a hyperbaric chamber. It is coordinated care near those who matter most.
You can't give up. You just have to keep going.
Really enjoyed meeting her today. Dr. Bhatia says he picks up the phone about 3 times a week and about once a week decides to fast track a patient in Houston. And it's just so much easier for those patients because they have a better way to transfer their files and their scans and everything to get down there, get care. Sometimes the protocol is written up and then they administer it here in central Indiana.
Well, and as always, more information on our website.
Yes, there is.
Ann Marie, thanks for the Health Beat tonight. Here and now is a look at what's coming up next at 5:30. John?